Hello, welcome to Module 7, Reactive COVID-19 Mitigation Strategies. My name is Alyosha Taramcic. I am Dairy Extension Associate at Cornell University. In this module, we will cover the mitigation strategies you can use when potential COVID-19 case is identified among your employees. We will first look at how likely it is that one of your employees turns out to be positive for COVID-19, followed by what to do when you have a potentially positive case among your employees. After removing the potentially positive employee from the facility and asking them to contact a health professional, what the company should do is perform contact tracing and identify any potential close contacts. So we will look into who is considered a close contact. We will look into when can an infected or potentially infected employee return to work. And most importantly, because identifying a potentially positive case among your employees will inevitably come as something unexpected, we will look at the value of preparation and the value of having a good plan in a form of a good SOP before any positive cases are identified. To finish, we will go through a decision tree that we at Cornell's Institute for Food Safety developed to simplify the decision-making when potential positive cases are identified among your employees. So, how likely it is that one of your employees turns out to be positive for COVID-19? If we look at the data from US from May 8th, there were more than 43,000 new confirmed cases every day, which translates into 1 out of 100 people getting infected every 76 days. So a food processing plant with 100 employees could expect at the time to have one positive case among employees every 2.5 months. And if we look at the peak numbers from December 2020, the same processing plant could expect one case every 2 weeks. In any case, it is enough that we should be concerned about it and have an appropriate plan when it happens. As we learned in the Module 6, there are proactive mitigation strategies like employee screening, forehead temperature checks, and surveillance testing that, if implemented correctly and consistently, will identify some of the potential cases among employees. But the same as any other mitigation strategy, these are not 100%, which is why we have to add a couple of extra slices of cheese that represent the reactive mitigation strategies to that Swiss cheese model that Dr. Kane talked about in Module 6. So even when our screening and testing procedures are consistently in place, getting a potentially positive case in the workplace is still something that can happen. For example, we have infected people that have yet to develop symptoms, people that develop symptoms that are mild and almost unrecognizable, or are even going through the entire course of the disease without ever developing any symptoms. So it is important to know that having a potential case is not a failure, but not handling them correctly can be a major failure, because it has the potential to quickly and unexpectedly reduce your workforce to numbers that force you to either slow down or even stop your operation. So what to do when you have a potentially positive case among your employees? There are 3 scenarios that require action. 1, employee tests positive. 2, employee develops compatible symptoms with COVID-19. Or 3, employee has close contact with a positive person. All 3 scenarios can be identified while person is either inside or outside of the workplace. The immediate action when potential case is in the workplace is to send them home to protect other employees. Remember, infected person is the main risk. It's not the air, it's not the surfaces, it's that close contact with the infected person and those respiratory droplets that infected person generates. So by removing them from the facility and asking them to contact a health professional, you are removing most of the risk to your employees and your operation. Next, you should perform contact tracing. Collect information about any close contacts among other employees and send the ones that are identified as close contacts home to quarantine. As you are performing contact tracing, remember that you have a legal obligation to protect confidentiality of any potential positive cases and close contacts. As you perform contact tracing, you should contact your local Department of Health and inform them of the situation and follow any instructions they might have for you. Although your local Department of Health will likely perform contact tracing as well, depending on the COVID-19 spread in the community and other cases they have to investigate, this contact tracing might be delayed, which is why your proactive plan has to include effective contact tracing procedures. You have to be able to identify any close contacts and react accordingly to each one of them. As a note, although according to CDC and FDA, critical infrastructure workers like food industry workers may be permitted to continue work following potential exposure to COVID-19. However, this practice should be followed only as the last resort and should always be approved by your local Department of Health. Last one is cleaning surfaces that potential positive case had contact with. In previous modules, we talked about the poor structure of the SARS-CoV-2 virus, how it will not survive outside of the host for long, and how contaminated surfaces represent only a minor risk. However, fresh surface contamination by a potential case is something that should be addressed, which is why CDC guidelines say if less than 24 hours have passed since positive case was in the space, you should clean and disinfect the surfaces. If more than 24 hours but less than 3 days have passed, you should only clean the surfaces. And if it's more than 3 days, the regular cleaning you're performing is sufficient to control that minimal residual risk. If positive cases have been working in a tight, confined space, CDC is also recommending to close off the space for a couple of hours before starting the cleaning and disinfecting. Our recommendation is to evacuate the space for 24 hours before going in to do the cleaning and disinfecting if less than 24 hours has passed since the positive case has been in this confined space. Now, if we go back to contact tracing for a moment and talk about who is considered a close contact. Close contact is a household member of an infected person, an intimate partner of an infected person, an individual providing care to an infected person in a household without using recommended infection control procedures, for example, not keeping 6 feet away at all times. Next, it is an individual who was directly coughed or sneezed on by an infected person. And finally, an individual who was within 6 feet of the infected person for at least 15 minutes within 24-hour period, starting 2 days before illness onset or before positive specimen collection until the time the criteria for return to work was met. We have 2 notes here. First one, contact is considered close contact regardless if face coverings were worn. And second note, the time of contact may vary between states. For example, in New York State, anything more than 10 minutes within 6 feet is already considered a close contact. Now, a third and maybe most important note is close contacts that were diagnosed with COVID-19 within the last 3 months or are fully vaccinated do not need to quarantine and can continue working. A person is considered fully vaccinated 2 weeks after the second dose of a 2-dose vaccine or 2 weeks after a single-dose vaccine. Even though these close contacts do not need to quarantine, they should be monitored for any symptoms. A person that developed any symptoms compatible with COVID-19 should be considered a potential positive case and removed from the facility regardless if they were fully vaccinated or were already diagnosed with COVID-19 within the last 3 months. Now, what are the criteria for return to work? Basically, it is any time your health provider or Department of Health say you are not a risk to others. Generally, when we are talking about isolation of persons that tested positive or developed compatible symptoms, there are 3 criteria that need to be met. Number 1, no fever in the last 24 hours without the use of medications to reduce the fever. Number 2, no other symptoms on the day you return to work. And number 3, at least 10 days has passed since the symptoms first started or since the sample that tested positive was collected. When it comes to ending quarantine of a close contact, the general rule is 14 days since the last contact with a positive person. According to CDC, the quarantine can be reduced to 10 days if no symptoms are present on that day. CDC also proposed the second option, reducing the quarantine to 7 days if the person is tested between day 5 and 7 and tests negative. Again, This can vary between states. For example, New York State has an option of reducing the quarantine to 10 days, but not the second option of reducing to 7 days with testing. So make sure you are in compliance with your local and state regulation. With this, we covered all of the main points you should be aware of when making a plan for when you have a potential positive case among your employees. It is very important to make a plan that is specific to the state you are in and be specific to the unique situation in your processing facility. It is best to make a plan in a form of a standard operating procedure that covers who is responsible for performing each task, when is each task performed, and how is each task performed. Also, it has to include who is responsible for verifying that each task was performed and performed correctly, as well as when and how verification is performed. And finally, it has to also describe procedures involved in proper record keeping. For more details on verification, please see Module 8, where Dr. Martin Weidman talks about verification and validation of mitigation strategies. Important part of writing SOPs for how to address potential cases among your employees is that you write them before you need them. So before you have a case among your employees, you think about how to handle it. Think about all the possible scenarios and have proper procedures ready for each scenario. You can imagine that once you have a potential case among your employees, or even several potential cases together with potential close contacts, it is inevitable that this represents an emergency situation that can even create some panic. It is important in those moments to remember that your SOPs contain all possible scenarios and how to react to each. So it is important to adhere to SOPs and control the overall panic in the facility. If you remain calm and show entire situation is under control, it will also help employees to stay calm, feel safe, cooperate with you, and continue uninterrupted operation. Final part that is very important is reviewing the SOPs on a regular basis and revise them according to changes in regulation, guidelines, and conditions in your facility. Although all SOPs need to be reviewed and revised on a regular basis, oftentimes they are not, because, for example, the regulation does not change very often. However, when it comes to COVID-19 and SOPs that protect employees from infection, we have all experienced the speed at which new scientific knowledge, regulation, and guidelines can change, which means that we really have to be on top of our game when it comes to revising the SOPs. It is best if one person on the COVID-19 control team is specifically tasked with keeping up to date with changes in science, regulation, and guidelines. What we at Cornell's Institute for Food Safety developed is a decision tree that you can use and modify to fit your specific situation. It is meant to show the main steps and decisions that your SOP describes in detail and to show them in a visually and easy to follow way. You have a decision tree and you can always refer to SOPs for any details. The decision tree starts with 2 black and gray boxes on top and continues with questions in purple and actions in blue. The purple questions are binary, so you answer and follow either yes or no. And the actions in blue, you perform and then follow the 1 arrow to the next question or action. There are also pink, brown, orange, and green boxes that correspond to large boxes of the same color on the left that provide more details about the questions or actions. We start with 1, employee develops symptoms compatible with COVID-19, or 2, employee is tested for COVID-19. Now, there's a lot of routine surveillance testing going on, in which case there are no restrictions for the tested employee. However, if the testing is performed due to high-risk activities or exposure, the employee should stay home until results come back. Once the employee is tested, the question is, does the employee test positive? If no, allow them to come back to work and continue self-monitoring. If yes, they should not be allowed to work. What they should do is contact their health provider, and you should contact your local Department of Health and follow any instructions that they might have for you. If we are dealing with number 1, an employee that developed any symptoms, the question is, what are the symptoms and how strict you want to be about them? We recommend that if the employee has fever, to send them home. if they have cough together with shortness of breath, or if they are experiencing loss of smell or taste, to also send them home. Next, in the red box, if the employee has any symptoms in combination with cough, or if they think they might have been in contact with a positive person, you should think, can you work without this employee? And if yes, send them home. And if no, talk to your local Department of Health if you can follow the CDC guidelines that say essential workers like food industry workers can keep working as long as they stay without symptoms and take other precautions. Now, for symptomatic employees and employees that tested positive, which were sent home, the next question is, has the employee been to work within the last 3 days of showing symptoms or testing positive? If yes, you should clean the surfaces this person came into contact and additionally disinfect surfaces this person came into contact within 24 hours of showing symptoms or testing positive. If this employee has been working within the last 24 hours of showing symptoms or testing positive and has been working in a tight confined space, you should consider evacuating the space for 24 hours before going in to clean and disinfect the space. The risk of air transmission is considered low. However, this type of situation is where it is recommended to take some extra precautions. Next steps would be to determine when an employee can return to work. Not less than 10 days after the symptoms started or person tested positive. At least 24 hours without fever or use of medications to lower fever, and also a person has to be without any symptoms when returning to work. You should also evaluate if this is the only positive employee you had recently, or is this a start of an outbreak in your plant? There is an option of stopping the production for 2 days or more, but with a good COVID-19 control program and sufficient number of unexposed employees, this should never happen. When you have a positive case among your employees, we said you should always do contact tracing. Did this employee have close contact with any other employees within 48 hours of showing symptoms or testing positive? Close contacts that were diagnosed with COVID-19 within the last 3 months or that are fully vaccinated are allowed to work, but should continue to self-monitor, and if there are any symptoms, should react to it regardless if they are vaccinated or had COVID-19 within the last 3 months. Reinfection before 3 months or infection of fully vaccinated people is less likely to happen, but it is not impossible. Whenever you identified a close contact and they are not fully vaccinated or recently recovered from COVID-19, you might consider asking them to quarantine even if they don't have symptoms, just to be on the safe side. But this will depend on whether or not you can work without this employee. With this, we have come full circle on this decision tree and in this module 7, reactive COVID-19 mitigation strategies. To finish, I will give you some take-home messages. Number 1, having a COVID-19 positive employee is a likely scenario. The spreading in your local community and the size of your operation will determine how likely this is. But it is likely enough that any operation should be ready by having a good COVID-19 control program in place. The key to good program is having good information on current regulation and guidelines in your state and information on the environment in your facility as well as how your facility functions. This information is then used to put together detailed SOPs and decision trees that cover all scenarios, questions, and decisions when you have a potential positive case among your employees. And when you do identify that potential case among your employees, remember to stay calm, trust in your plan, and don't be hesitant with reaching out to your Department of Health, your food inspection agency, and other institutions and people that are there to help you. Last take-home message is to regularly review, evaluate, and update your COVID-19 control program. This pandemic has been a very dynamic environment where guidelines and regulations are changing on a daily basis. New scientific data is being generated on a daily basis, and you should review those updates on a daily basis as well and use them to regularly update your COVID-19 control program. As we said, it is best to have a person designated to keep up to date on everything that's new and relevant to your operation and the health of your employees. Thank you and stay safe.